So should I get on there? And then I'm muted.
Good afternoon, everyone. I think even though everybody is not here yet, we're going to get started. We're going to start with MSDE early childhood development. And we have Ann Wagner as our budget analyst here today. So Ann, take it away.
All right. Thank you very much, Madam Chair, members of the committee. I'll just get the analysis up on the screen. All right. So today, sorry, the echoing. Apologies. Today I'm presenting the budget analysis for MSDE's early childhood development programs that are administered by the Division of Early Childhood. I'm going to skip ahead to the performance analysis section. Exhibit 1 shows the state's results on the kindergarten readiness assessment. This assessment measures incoming kindergartner school readiness level, with demonstrating readiness as being the highest level. In the 21 to 22 school year, the statewide participation or proportion of students demonstrating readiness fell to just under 40%. And this is a 5 percentage point decrease compared to pre-pandemic levels. Certain subgroups of students, including children with disabilities, English learners, and low-income direct certified children, have persistently reported lower proportions of students demonstrating readiness compared to the statewide results. Each of these groups also saw decreases in the proportion demonstrating readiness compared to pre-pandemic levels. And so we highlight the KRA results here as the Accountability and Implementation Board, or AIB, has identified this as one of the performance measures it will be monitoring for assessing the success of early childhood expansion efforts under the Blueprint for Maryland's Future. So then moving on to the budget discussion, starting with fiscal 22. As part of the American Rescue Plan, Maryland received about $309 million to help stabilize the childcare industry while providers were dealing with the impacts of the COVID-19 pandemic. MSDE distributed $286 million of the federal funds to childcare providers through 2 separate rounds of stabilization grants in fiscal 22. The first round was distributed between September and December of 2021. This awarded $159 million to over 5,200 providers. The second round of grants was distributed from January to March of 2022, and that provided $128 million to over 5,300 providers. MSCE noted in a response to last year's Joint Chairman's report that it streamlined the grant application provided more customer service to applicants, and reviewed applications on a rolling basis to improve processing times during that second application cycle. And in addition to ARPA federal funds, there were also $50 million in general funds allocated in fiscal 22, and then $3.2 million in general funds allocated in fiscal 23 to award additional stabilization grants. MSCE retained $50 million to spend in fiscal 23 and administered a third round of grants in fall of 2022. There was 2022 legislation and language in the fiscal 23 budget bill that specified that the state-funded stabilization grants should give preference to certain childcare providers that meet the criteria and characteristics that are listed on page 8 of the analysis in that order of priority. As of February 1st, there had not been an application posted for the remaining $3.2 million in general funds budgeted in fiscal 23. And so MSDE is asked to provide an update on the state-funded stabilization grants that have been awarded in fiscal 23, including the timing of when that additional $3.2 million will be awarded. DLS is recommending that the committees adopt narrative requesting a report on all stabilization grant allocations with descriptions for how the childcare providers spend those grants. Also note that a similar report was requested in last year's JCR, and as of the writing of this analysis, that report had not been submitted, but MSD has since provided that response. So next, the analysis highlights some new programs and financial assistance that were established in legislation last year to support childcare providers. This includes $16 million for one-time bonuses in fiscal 23 for childcare providers and employees to improve recruitment and retention. The second item shows that legislation established a therapeutic childcare grant program for providers of specialized childcare and early education to children with certain developmental delays or physical disabilities. This program is allocated $3.7 million in fiscal 23 and 24. A bill also created the Child Care Capital Support Revolving Loan Fund, and this offers no interest loans for certain providers' capital expenses. And so there's $15 million budgeted for the fund in fiscal 23 and $10 million budgeted in fiscal 24. This fund is budgeted under the Department of Commerce, but we wanted to highlight it as additional support for childcare providers. So then the next exhibit on page 11 provides an overview of the fiscal 24 allowance for early childhood development programs. That allowance totals $442 million. Between the Child Care Scholarship Program, which provides financial assistance with childcare tuition costs, and then publicly funded pre-K, about $300 million or 68% of this budget pays for children and families with low incomes to access early childhood programs. Exhibit 4 on pages 12 and 13 outline changes in the allowance compared to the fiscal 23 working appropriation. Across MSCE's Division of Early Childhood and Early Childhood Programs, the allowance shows a net decrease of about $113 million. The largest driver of this decrease is the fiscal 23 working appropriation, including American Rescue Plan federal funds from a supplemental child care and development block grant that were budgeted in fiscal 23, but the allowance does not yet reflect this funding. And so I'll discuss this issue more later. And then on page 2, we highlight that the support materials provided with the allowance had reflected an $11.2 million line item for a grant under the Division of Early Childhood. And so the department is asked to explain how those grant funds will be spent. Moving on to personnel, the allowance converts 16 contractual positions into new regular positions that is mostly made up of licensing specialists. Looking at the Division of Early Childhood's vacancies as of December 31st of 2022, there were 15 vacant positions, or a vacancy rate of about 9.5%. This is a significant increase compared to the 3.6% vacancy rate reported in December of 2021. And this growth in vacancies is occurring as the division's workload is increasing with pre-K and childcare scholarship expansion efforts. And so MSD is asked to discuss the factors that led to this rapid increase in Division of Early Childhood vacancies and what efforts it is now taking to improve recruitment and retention. So then moving on to the issues section of this analysis, starting on page 16. This first issue outlines the early childhood expansion efforts and mandates included in the blueprint. Exhibit 5 shows the funding across these initiatives. The allowance meets mandated funding levels for each component, and those details are outlined further in Appendix 4. The largest component of the early childhood blueprint initiatives is the full day pre-K formula that's distributed through the Maryland State Pre-Kindergarten Grant Program. And that funds pre-K slots in both public and private programs. Other provisions include level funding pre-K expansion grants, and those also support full day pre-K slots for low-income families. That program will eventually consolidate with the formula funding in fiscal 26. The allowance also includes more wraparound services by funding new Judy centers and Patty centers, or what were formerly called family support centers. And those both provide educational and health-related services to young children and their families. Looking at Exhibit 6, this shows publicly funded pre-K expenses leading up to fiscal 23, which was the first year that the full day pre-K formula was implemented, and then through the allowance. The formula is jointly funded by state and local governments, and it's based on a per pupil amount that phases in from fiscal 23 to 2030. In the first few years of implementation, the formula will fund full day pre-K slots for children with family incomes at or below 300% of the federal poverty level. And then beginning in fiscal 25, children with family incomes between 300% and 600% of the federal poverty level will be able to receive a partially funded pre-K slot, with the family paying a share of the cost based on a sliding scale that the department will develop. In fiscal 23, you're seeing that local school systems did run into an implementation issue because they could not identify which children had family incomes at 300% of federal poverty or less. As a result, MSDE provided the state share of pre-K formula costs for all children enrolled in public pre-K, regardless of their income. And so this led to the formula being funded at about $144 million, as it included a discretionary enhancement to serve more children than was required in statute. And then in fiscal 24, that income determination issue was resolved, and the formula returns to the calculation that was established in statute. So that leads to a $44 million decrease in the formula. So I'll move on to issue 2. This has to do with the Child Care Scholarship Program. Exhibit 7 shows recent enrollment trends in that program, showing that there had been a sharp decline in the number of children participating from May 2020 to December of 2021. And that was while the COVID-19 pandemic limited the number of open childcare programs, and then demand for childcare services was reduced. Since around January of 2022, you're seeing enrollment has climbed back up. And just recently, enrollment passed the pre-pandemic high enrollment level, with almost 21,000 children participating in October of 2022. And so overall, this increase in enrollment corresponded with certain program expansion efforts that took effect in May of 2022. These changes are described on page 22. And so this included increasing provider reimbursement rates to the 70th percentile of market rates. It included raising income eligibility levels to 75% of the state median income, and waiving or reducing co-payments assigned to participating families. MSC has announced some additional changes to the Child Care Scholarship Program that are specifically trying to streamline application processing and improve customer service. Legislation from last year, specifically chapters 525 and 526, required some of these changes, like MSC establishing presumptive eligibility, and that will allow families that attest their eligibility to receive scholarship payments while their application is being processed. That bill also set certain requirements for payment processing by MSD and the comptroller. And then MSD indicated, sorry, it's on the next page, but MSD indicated in an October 2022 memo that it would transition child care scholarship provider reimbursements from retroactive payments that were based on attendance to advanced payments that are based on enrollment. And so considering these efforts, DLS is recommending adopting committee narrative that requests MSD set annual goals and provide customer service and application processing measures as part of its annual managing for results submission. And so moving on to a discussion of the child care scholarship budget. Despite most of these program changes continuing through fiscal 24, you are seeing that the budget for childcare scholarships decreases. And this is mainly due to about $64 million in American Rescue Plan federal funds appearing in the working appropriation, but then no funds from that American Rescue Plan provision being budgeted in the allowance yet. This decrease is partially offset by an increase of $10 million in additional general funds. And moving back to the supplemental child care development block grant from the American Rescue Plan, Maryland received about $200 million through that award, and that can be used flexibly to strengthen the early childhood system and to make childcare more affordable and accessible. MSC had planned to spend some of this funding on the child care scholarship program changes I just described, and then also the funds would be used to distribute grants under a new Maryland Rebuilds program and to support a major IT project that modernizes the legacy child care administration tracking system. And so on page 25, the analysis outlines different cost estimates related to those child care scholarship program changes. These were provided by Towson's Regional Economic Studies Institute, which serves as MSD's data analysis vendor for this program. The child care scholarship program changes are estimated to cost $56 million in fiscal 23, and then a total of $67 million each year in fiscal 24 and 25. And so based on these costs, projected fiscal 24 spending on scholarships would be just under $230 million, but the allowance only provides $174 million in total funds. State funds would be needed eventually to cover the added costs of these changes, and the fiscal 24 allowance does include that $10 million in additional general funds to cover a small portion of these costs. However, based on the current budget plan, there is an estimated $96 million in American Rescue Plan federal funds that have not yet been allocated. And those funds could cover the additional program costs in fiscal 24. And so considering this unappropriated federal support, DLS is recommending a reduction of the $10 million in additional general funds with language authorizing a budget amendment to bring in an equivalent amount of those American Rescue Plan funds. And so after the American Rescue Plan funds are fully expended, there would be a potentially significant state fund need. And the analysis notes concern for the child care scholarship program's ongoing sustainability beyond fiscal 2024. And so MSD is asked to provide an update on how those supplemental child care development block grant funds from the American Rescue Plan will be allocated, the timing of that. And MSC is also asked to provide RESI's latest fiscal 23 and 24 cost estimates for the program, and then a plan for sustaining the recent program expansion after the one-time federal funds are expended. And so DLS is also recommending adopting narrative requesting quarterly enrollment and expenditure reports for the CCS program as the committees have received in past years. And with that, I'll conclude the presentation.
Nice job. Thank you very much. Okay, we have Mohammed Chowdhury, the State Superintendent of Schools, and Justin Dayhoff, the Assistant State Superintendent, Division of Financial Planning, Operations, and Strategy. Come on up to the table.
All right, good afternoon.
Good afternoon.
Senate Chair King and members of the subcommittee. It's good to be here. Thank you, Ms. Wagner, for your thoughtful analysis, and my thanks to all of you for your continued commitment to early childhood education. I am honored to be here today and in service to our pre-K and childcare communities that have faced challenges throughout the pandemic and who yet remain the backbone for Maryland's recovery. This community has been an early focus of my administration, and I look forward to discussing our early childhood budget and the work those important resources support, as well as major policy shifts we implemented this year to better serve the childcare community and improve the childcare scholarship program. To that end, I will respond to the analysis. With blueprint implementation in progress amidst billions in one-time COVID aid programs, I want to start by responding to the analysis notes on staffing and vacancies. MSD concurs that the department experienced an increase in vacancies between last December and this December in the Division of Early Childhood. Those vacancies do not come as a surprise, a state hiring freeze that was lifted in January of 2022, persistently low state salaries, and the provision of contractual rather than permanent positions generated an increase in MSDE vacancies. Those vacancies are felt harder at MSD given the year-over-year reductions in MSDE permanent positions overall in the decade leading to the start of my term last year, with new and increasing requirements and obligations like the blueprint for Maryland's future. That being said, MSD took action and continues to emphasize recruitment and retention. This year's department budget proposal reflects these efforts. Efforts specific to the Division of Early Childhood include the conversion of 15 contractual positions to permanent positions in fiscal year 24. In addition, we identified licensing specialists as a particular source of higher than average turnover. Licensing specialists in the Division of Early Childhood are responsible for inspecting, credentialing, and providing assistance to childcare providers to ensure safe childcare. These positions currently have a ratio as low as 56:1 and as high as 78:1 providers per specialist. A comprehensive comparative analysis of childcare licensing positions indicate that low compensation as well as restrictive and outdated minimal qualifications are the biggest issues impacting the hiring and retention of the Division of Early Childcare licensing specialists. I proposed a 2-grade pay increase, about 12% to employees in the licensing job series, which increases the starting salary for trainees to $60,000 starting July 1, 2023. This proposal has been approved by DBM and is included in MSDE's fiscal year 2024 budget allowance. It has taken time and effort to implement our new HR structure and to begin to see the structure operate in the way and with the rigor and consistency intended. For example, MSD's most recent DEC recruitment that concluded last week resulted in 246 qualified candidates, the highest pool ever, scheduled to be interviewed for 18 licensing specialist vacancies during the last week of February. The interviews will take place in 5 regions around the state over multiple days with multiple interview panels interviewing candidates. My goal is to close that vacancy gap by the end of this month. I have made clear to my team that while hiring challenges are not unique to MSDE, personnel challenges are not a reason for falling short of expectations or failing to get the work done. One example of that is in our work on the Child Care Scholarship Program. The one other thing that I would note that was in a JCR not related to this, at the high end of my first year, there were about 300 vacancies. Today, there is less than 150. 50 of those are indoors. The vacancy rate has been cut in half overall in the aggregate. Child Care Scholarship Program. I will start today with the Child Care Scholarship Program, that the policy changes were adopted this year for context and for many members of the committee who may not yet be aware. The Child Care Scholarship Program ensures Maryland's children and families can access affordable child care and, if eligible based on income, receive direct financial support to do so. The MSD Division of Early Childhood supports over 7,000 child care providers in Maryland. Over 2,500 of these service providers participate in the Child Care Scholarship Program, which supports over 12,000 families and over 20,000 children, an increase over pre-pandemic levels. Shortly after I began my term, I became acutely aware of the struggles our childcare community was and is facing. Struggles my administration inherited, but ones I resolved to address head-on. My first priority was pandemic recovery, improving implementation of the federal stabilization grants and other relief efforts to make sure that our providers could sustain childcare services and continue forward amidst the uncertainties and challenges of the pandemic. Throughout that effort, I also became increasingly aware of the historical challenges I inherited associated with administering the Child Care Scholarship Program. These challenges range from facing multiple attendance verification audits throughout the year to delayed payments. Further slow processing of Child Care Scholarship Program application affects the Maryland State Department of Education's ability to provide timely reimbursement for the children that providers are serving each day. Payment issues are amplified by the length of time it takes for MSDE technical systems to issue payment. Receiving payments 15 days after the start of a service period at best can put providers who often work payment to payment in a precarious situation at a time when we are trying to recover from the global pandemic and get Maryland back to work while ensuring that our children have the best possible care. For those reasons, this summer, MSDE used the emergency allowances of federal child care development funds to implement some stopgap measures for the child care scholarship program. First, we switched to an enrollment base rather than an attendance-based scholarship payment system. The switch allowed MSDE to pay providers the full amount of their scholarship enrollment each 2 weeks, regardless of whether or not the children were in attendance. This matters because without this policy, providers do not and have not until this year been paid for a student when the child is absent. That presents a challenge because providers do not know when a child will be sick or miss a day, and providers cannot release a slot for 1 day. Ultimately, the state has asked child care scholarship participating providers to absorb this cost. Paying based on enrollment addresses this issue. Second, we issued one-time additional payments in August to help offset delays of scholarship processing and ongoing pandemic-related recovery. Third, we issued a special one-time child care scholarship program retention payment. Those actions were Band-Aids and not intended to eliminate ongoing challenges. I will highlight briefly system-wide permanent policy changes MSD made to address these concerns, and I have included in our written testimony the full policy memorandum we released to the provider community with more detailed information, including how the changes work. MSD's policy changes include both the use of advance payment, which is an MSDE identified first in the nation policy, and a pilot program for presumptive eligibility that gives the department a head start in meeting the July 1, 2023 requirement to implement presumptive eligibility statewide per last year's legislation. To be clear, advance payment and presumptive eligibility both involve increasing payment speed to providers based on the children they serve. But these are different policies. Understanding the difference between the two will be important for providers and the community, and I want to also make the clear distinction here as well. Advance payment refers to paying providers at the start of the month and midway through the month, before they serve the children they enroll, rather than paying retroactively after the service period. Presumptive eligibility refers to assuming immediately upon receipt of a brief form that a family is eligible for the child care scholarship program and issuing a receipted voucher. First, advance payments. Prior to MSD's new policies, MSD paid providers retroactively based on student attendance. MSD issued payments to providers based on actual student attendance after the time in which providers served the children. For example, if a student attends each day during a service period between March 1st and March 14th, MSD would begin to process the payment for that provider who enrolls the student with the receipted scholarship voucher on March 15th. The MSD payment process also added additional time. Once a provider invoice was received and processed, which can take 5 days, MSD began the batch process in its accounting systems. 2 to 4 days later, MSD would send payment information to the General Accounting Division of the Comptroller to remit payment. As such, providers often received payment more than 2 weeks after they had already paid for and served the children who they enroll. Income margins are small for our providers, and paying retroactively makes every dollar and every day count even more. Now, MSD pays providers in advance, not retroactively, and MSD issues the advance payment based on enrollment, where enrollment is defined as the number of students with active child care scholarship program vouchers assigned to a given provider at the end of the previous calendar month. Although many states across the country made this change during the pandemic, only a few states ensured that childcare and education programs were being paid by enrollment and not attendance long-term. Maryland is a leader in the country because MSD's idea to support early care and education programs to be more financially stable through the use of advance payments is truly a model policy, and MSD is the only state in the country to adopt this so far. MSD transitioned to this process in January, and with the new technical deployments complete, providers began receiving payment on February 2nd for their February services ending on February 28th. MSD can confidently say the policy shift is successful and now in place. This policy change includes 2 additional updates that impact providers. First, in keeping the enrollment-based payments, MSD will no longer reconcile provider reimbursement based on the attendance of children with receipted scholarship vouchers and will pay for the full month regardless of the number of days a student attends. Second, MSD collapsed the service period from 10 days to once per month. MSD, as per recommendations from the Office of Legislative Audits, conducts an attendance audit on 25% of invoices each service period. Collapsing service periods in half has reduced the audit burden for providers by half immediately. I will note the change is hard, and though these updates addressing longstanding issues with the childcare community, change is not necessarily easier. For that reason, MSD has made sure to continue providing updates and opportunities for engagement around these changes and done so in multiple languages and mediums. MSD will continue to do so with the following January rollout. Last year, the General Assembly passed House Bill 995, which established a presumptive eligibility program where an MSD will, upon completion of a brief and abbreviated form, assume a childcare scholarship program. Applicant family is eligible for a voucher and begin reimbursing a provider for that child immediately. If after that time, the applicant is still eligible, no changes would occur. If after that time, the applicant is ineligible, MSD will notify the provider and will cease reimbursement. The provider will not, under this program, need to reimburse MSD for payments issued while MSD presume the family to be eligible. To ensure MSD can meet its statutory deadline to implement presumptive eligibility, MSD will embark on a pilot program this March and April with Baltimore City, the jurisdiction that has the largest group of potentially eligible families. The pilot will allow MSD to identify the funding necessary to sustain the program and continue to offset voucher payments MSD makes to families who turn out to be ineligible rather than charge back providers. MSD will then expand to open the full presumptive eligibility program statewide on July 1, 2023. With regard to the Child Care Scholarship Program and the program's overall rate structure and funding, MSD leveraged American Rescue Plan funds to increase program accessibility by reducing the eligibility cutoff and increasing the provider reimbursement rate. MSD increased the income eligibility for families to 75% of the state median income for initial program applications and increased provider reimbursement rates to the 70th percentile of market rates. That change in rates began in the last quarter of fiscal year 2022. Estimates of the costs associated with permanent maintenance of the new Child Care Scholarship Program eligibility thresholds, reimbursement rates, and copayment support vary. Currently, MSD pays on average $10 million per pay period, of which there are 2 each month. This would result in approximately $30 million needed above existing appropriation. However, this estimate is incomplete. Additional families are returning to the program, and MSD expects that the state's new presumptive eligibility rules that take full effect in July of 23 will further drive participation in the program. The General Assembly required MSD to study the anticipated permanent costs of these policies, and the results of the analysis and recommendations from the Center for Law and Social Policy, or CLASP, are in our written response. In short, CLASP estimates that the state would need between $72 million and $136 million in additional annual federal and state funding to offer robust support through the Child Care Scholarship Program for all families now eligible under all the new eligibility and reimbursement rates, but who were previously denied. The low end of this estimate assumes that 50% of eligible children would access the program, and the high end assumes that all eligible families, 100%, would access the program. The increased costs are almost entirely associated with increased reimbursement rates, copayment coverage, and reduced eligibility cutoffs, not presumptive eligibility. CLASP estimates that each family who applies and receives services through presumptive eligibility, but is then deemed ineligible following the presumptive eligibility period, would cost the state approximately $3,100. CLASP estimates this number to be less than 1,000 families per year and likely far lower. MSD was one of the first states in the country to release the federal stabilization grant money to childcare providers. Nonetheless, last year at our early childhood budget hearing, we discussed the challenges with the department's administration of the first round of the federal stabilization grant funding. I'm happy to report that improvements to the program in the January launch led to quick results. After engagement with the childcare community to improve the process, including the accessibility of the program for childcare providers from all Maryland communities, MSD provided 6 live customer support sessions to help walk providers through all aspects of the grant application process. MSD set up multilingual robocalls, used social media, weekly messages, and direct mail outreach to encourage participation. Consequently, MSD received more than 6,000 applications for round two payments and met its March target date for payment issuance to all awarded applicants. MSD distributed the balance of federal stabilization funding using unclaimed pre-calculated awards this past summer, July and August 2022. MSD leveraged its experience from this program to readily administer the $53.2 million in the Governor's Stabilization Grant Program in August and September. MSD opened the application window in August and closed the window at the end of August. MSD had completed 95% of the payments by the second week of September. MSD distributed more than $30 million in payments within 2 weeks of the application window closing. MSD, as with the federal program, provided time to resolve any lingering questions or applications that required additional information, and will complete distributing the balance of funds by the first quarter of this calendar year. In addition to the stabilization funds, this year MSD is administering a new one-time bonus retention program for eligible childcare providers and their employees based on the language passed in House Bill 1100 from the 2022 legislative session. This program establishes 3 pockets of funding: $10 million in $1,000 individual bonuses for providers and their employees who were working before July 1, 2022, and who have or will by June 30th, 2023, complete a credential from the Maryland Child Care Credential Program. $4 million in split $500 and $500 bonuses for providers and employees who started on or after July 1, 2022, and who have or will by June 30, 2023, complete a credential from the Maryland Child Care Credential Program. And $2 million comprised of $500 hiring bonuses for providers who have hired new employees on or after July 1, 2023 to support onboarding, recruitment, and initial salary costs. MSD opened applications in November and began sending out award letters in January. Final award notices and payments are being sent out this month to all providers who were eligible in the order applications were received, since the program was on a first-come, first-served basis. Now I want to turn to our state set aside. In addition to American Rescue Plan funding associated with the Child Care Scholarship Program and the Federal Stabilization Program, MSD also had discretionary resources as state set aside. With those resources, I directed MSD to create a new grant opportunity based on feedback from the early childhood community that targeted 7 research-based high leverage strategy areas. This program, Maryland Rebuilds, was designed to support the state's childcare system in utilizing federal funds to stabilize, strengthen, and sustain the childcare system and mitigate the impact of the COVID-19 pandemic. Maryland Rebuilds is also designed to kickstart and lay the foundation for blueprint early childhood programs and requirements. MSD received 167 applications and awarded more than $25 million to Rebuilds applicants. MSD, as it does with all of its grant programs, applied a rigorous process to the application review, including ensuring that at least 3 different reviewers scored each application. The process was one that balanced the desire to award as much as possible while ensuring that grant program quality and awarded dollars are most likely to generate a specific clear outcome goal. MSD also prioritized issuing grants to applicants who do not traditionally receive or take part in the grant programs to encourage innovation and expand engagement. MSD issued award letters in December, and MSD will publicly announce the awardees and their programs this spring as it finalizes notices of grant awards and looks forward to supporting awardees in successfully implementing their approved programs and achieving the planned measurable outcomes of the program. For example, MSD awarded more than $1 million to Luna Family Support Services for the creation of a family child care incubator and apprenticeship program that is designed to be responsive to the unique languages and cultural needs of the Latino community, a population of providers and families that has been severely underserved in most parts of Maryland for decades. Tip Top Tots Early Learning Center, another awardee, fun name to say, will develop a paid apprenticeship program aimed at recruiting and training individuals or groups of individuals to enter the childcare workforce, with an emphasis on gaining clinical experience that builds representation across diverse communities and working with vulnerable populations. Another example, Montgomery College, with its award, will develop a process to formally recognize and grant credit for prior learning experiences that are equally rigorous as traditional degree and certification pathways. It is long overdue that we give credit for life experiences that are equally rigorous as college degrees. Beyond the other Maryland Rebuilds awardees, remaining discretionary American Rescue Plan childcare resources are going to expand existing initiatives, including more than $75 million for the childcare scholarship program reimbursement and the expansion of Judy Center learning hubs. For this reason, MSDE respectfully but strongly disagrees with the proposed reduction of $10 million in general fund support for the childcare scholarship program and addition of $10 million in unappropriated supplemental CCDBG funding. While the department has a small balance of ARP discretionary funds available to offset the program shortfall in fiscal year 24, reducing the program by $10 million in general funds may further exacerbate the issue. The policy changes implemented with the ARP discretionary funds support and sustain childcare providers participating in the childcare scholarship program and provide much needed support to low-wage earners who would not otherwise qualify for this benefit. Again, I appreciate the collaborative relationship with DLS, and I extend our thanks once again to Ms. Wagner for her excellent analysis. Thank you.
Thank you. Any questions from the committee? Well, I have one here, was brought to my attention. Looking at FY23, the analysis describes a one-time fiscal 2023 discretionary enhancement to the full-day pre-kindergarten formula resulting from an eligibility determination issue. It's on page 12. Apparently, the FY23 calculation was based on funding roughly 27,600 pre-K slots. And could you explain a bit more about what went into that calculation and why the FY24 calculation factors in only 17,100 slots for a $44.5 million decrease? And are there really that many fewer pre-K students?
So,
I'd be happy to respond, Chair King. So previously to the blueprint, the department's enrollment file that we use to calculate state aid every year didn't collect for pre-K enrollment, either the income data or what the blueprint refers to as tier data for the pre-K eligible students. So last year when we went to do this for the first time, the data infrastructure wasn't there to physically collect the information. All that we could collect, and we did, was pre-K enrollment and half-day, full-day status. So we also had free and reduced price meal eligibility for pre-K. That is at 185% federal poverty level, which is below the tier 1 cutoff of 300% FPL. So we essentially presented two options for state aid purposes for last year. One being, if we do it strictly according to what's here and the data that we have for the students that we can validate that meet the income requirements and the eligibility requirements of the program. So this would be 3- and 4-year-olds at or below 300% federal poverty level who attend a full day pre-K. We could only do the subgroup of that who are at the 185%. So we'd be undercounting students in the formula. And so instead, the other number that we had available to us at the time for state aid purposes was essentially that blanket cost. And that includes both full day and half day students. So half day students are not eligible in Blueprint for that tier 1 piece. And so a lot of it comes from the full day versus half day distinction. And the other piece is essentially now we're including the income component, whereas last year that was not included. It was just the full count.
Okay, thank you. Yes, sir.
So I'm just trying to get some clarification on this whole child care scholarship situation here with the 10 million. So the way I understood it, I mean, the analysts can help me, that we're almost kind of just using a different funding source. We're taking the 10 million out of the general fund, we're putting 10 million in from supplemental, so it should be even. But I heard you say that you object to that, but I'm just trying to figure out what's the issue there? Because you're not losing any funding, it's the same money. Is it because, I guess if you could expand on that.
He'll give you the detailed breakdown on why we need the federal dollars for something else. And that's why we need the general fund to cover it. But why don't you go ahead and give the breakdown?
So the Maryland Rebuilds program was comprehensive and included a wide range of programs. So there's the competitive side, which is where we have that $25 million in discretionary funding that was awarded. But in addition to that, the department's original budget plan let me take a step back for a second. In ARP childcare funds, there are about 500 million, just over $500 million. 309 million of that was allocated specifically to the federal childcare stabilization program. So that led to $193 million total in ARP childcare discretionary funding. The department put about $75 million of that off the top towards these increased provider reimbursement rates and the reduced eligibility cutoff thresholds for the Child Care Scholarship Program. In addition to that, it also expanded a number of programs across the state, including, for example, expanding Judy centers to try and get a kickstart on some of the blueprint requirements to meet our Judy center target numbers, as well as a wide range of other initiatives at the state. And so that, in conjunction with the Maryland Rebuilds program, and with the upcoming, as Ms. Wagner pointed out in the analysis, the upcoming cost associated with the new rates for the Child Care Scholarship Program, having those funds and being able to use those federal funds essentially will allow us to further extend that before we dip into state funds to continue covering it.
Okay, thank you.
Okay, any other questions? Okay, thank you very much.
Thank you, Senator King. Thank you, Chair.
Okay, we have one witness today, Laura Wheeldryer from the Maryland Family Network.
Good afternoon. Thank you, Madam Chair and committee members, for the opportunity to testify today. I'm Laura Wheeldryer, the Executive Director of Maryland Family Network. And every year, as advocates, we carefully monitor the state's investment in young children and their families, which of course includes the budget for MSD's Division of Early Childhood. The proposed FY24 budget reflects your leadership and proud achievements for the state in the form of critical investments, such as the landmark blueprint for Maryland's future. Thank you to DLS for your thorough and incisive budget analysis. We support and urge this committee's support for the proposed FY24 budget. However, most urgently and significantly, we must reject the DLS recommendation to cut the $10 million from the Child Care Scholarship Program allocation. The Child Care Scholarship Program allocation is the single biggest public investment in childcare and truly critical to sustaining the progress that Maryland has seen. As noted by DLS, enrollment is on the upswing, even as the field recovers quite slowly from the effects of the pandemic. As a state, we have not yet absorbed the impact of recent enhancements to the Child Care Scholarship Program, including major changes, some of which you just heard the state superintendent rundown. Presumptive eligibility is enacted by the General Assembly, increased provider reimbursement rates, increased family eligibility, decreased co-payments, and some truly innovative policies that MSD is really taking a leadership role in nationally. Superintendent Chaudhary spoke of this early payment or the prepayments and moving from attendance to enrollment-based payments for childcare providers. We would respectfully submit that this is precisely the wrong moment for disinvestment in childcare scholarship. Madam Chair, if I may, I'd like to add a few comments about another topic that you and I have discussed recently. As you know, Maryland Family Network and the Maryland State Department of Education have been partners in multiple ways dating back many, many years. I appreciate that the new MSD leadership team has undertaken a reassessment of the department's grant-making policies and practices. And we're very excited about some of the overall early childhood policy work they are pursuing, including the work they talked about today. The reassessment of grant-making policies and practices is, of course, Superintendent Chaudhary's prerogative, and it actually makes total sense to us that they would want to do that. But also, I have to note for the record that it has caused some big bumps in the road for MFN and perhaps for other external partners to MSDE. Many of those bumps in the road have, in my opinion, resulted from miscommunication between the department and its partners. And while the problems we've experienced have posed real challenges to the services we provide at MFN, we've very recently seen some positive movement, and we're encouraged by that. MSD has reached out to us, and I'm very confident that we all are interested and committed to working towards resolution. Maryland Family Network remains eager and committed to being the very best partner to MSD that we can be. Thank you very much for the opportunity to testify and for allowing me to make these comments.
Thank you so much. Questions or comments? Okay, thank you very much. Have a nice weekend. Okay, next on our list is the University of Maryland, Baltimore campus. Sarah Baker is our analyst. Her doggie's in doggy daycare, so she can come and join us.
Okay, I'm going to start with Exhibit 1 on page 4, which shows changes in the fall enrollment. For the first time since 2012, enrollment decreased by 313 students due to new graduate students declining by 311. And this decrease is related to 4 programs. Declines in the medical cannabis and cybersecurity law are related to the high demand when they were first offered, but now they've been offered for a while. Enrollment is leveling off. Enrollment declines in the Master of Social Work and Pharmacy Professional Doctorate, or PharmD, mirrors national trends of decreasing demand and increased competition from recently created programs at competing institutions. Exhibit 2 on page 5 shows enrollment in medical-related professional programs. Despite a slight decrease of 55 students in 2022, demand for all levels of nursing programs remains strong. The increase in pharmacy programs is due to the medical cannabis program, which started in 2019, and while enrollment in PharmD program has steadily declined since 2018. Exhibit 3 on page 6 shows the number of medical-related professional graduates. Overall, nursing degrees account for over 60% of graduates, which reached its highest level in 2020 of 756 degrees. The decline in the nursing degree is mainly attributed to a decrease in the number of masters in science and nursing. The number of PharmD degrees awarded has fallen 20.8% since 2020, reflecting declining enrollment. Turning to affordability on page 6, this shows the cost of attendance by professional programs, which ranges from almost $50,000 for the Master of Social Work to over $96,000 for the dental program. UMB has established affordability metrics to serve as a basis for setting tuition and its financial aid program. And they have found that even with graduating with high levels of debt, their programs are affordable to most students. We also note that geography impacts the accumulation of debt, earnings, and repayment, and that lower level salaries in underserved areas in the state makes it less affordable for graduates to work there. So UMB is using institutional financial aid to create award packages to make it more affordable for low-income students. Exhibit 5 on page 9 shows average debt by program, and you can see that the dental graduates have the highest average debt of over $300,000. Now moving on to the budget on page 11. Exhibit 6 shows budget changes for unrestricted funds by program areas for 22 and 23. Overall expenditures increased $64.1 million, or 8.5%. A majority of the increase in spending across all program areas is due to the 23 salary increases. I do note that the $1.3 million increase in instruction is due to the increase in financial aid that was provided in the 23 supplemental budget number 4. Exhibit 7 shows on page 12 shows the proposed budget. After adjusting the 23 and 24 budgets, state funding increased by 11.5%, or by $37.9 million. 20 and 24 general funds increase. The general salary increases account for 64.7%, or $24.5 million of the increase in state funds. And funds also include $1 million as mandated for the Empowering Joint Steering Committee. This leaves $14.9 million in state funds to be used to cover other current cost services or program enhancement. We asked the president to comment on how UMB intends to use the $14.9 million in state funds. Exhibit 8 on page 14 shows unrestricted funds by revenue. As you can see, the pandemic impacted the revenues starting in 2020, when revenues from educational activities, including clinical practices, went from comprising 27% of revenues to 19%. But federal relief funding did help mitigate some loss of revenues, resulting in only a slight decline in total unrestricted revenues. Tuition and fee revenues go from comprising 23% of revenues in 2022 to 21% in 23, reflecting a decline in enrollment. State funding accounts for an increasing portion of revenues, growing from 34% in 2022 to 40% in 23, and this can partly be attributed to the general salary increases. I have one issue, and this is on page 16 of the Institute for Health Computing. Empowering in partnership with the University of Maryland Medical System announced the establishment of the institution this past fall. Other collaborators include universities at Shady Grove and UMBC. The institute will incorporate technologies to study emerging diseases and help establish precision patient control to halt disease progression. For example, poorly controlled diabetes, high blood pressure, or early kidney disease can be identified by trending changes in lab tests in outpatients. This allows for targeted interventions to prevent progression of disease. So de-identified data from 1.8 million patients, along with clinical research data for UMB, will provide the backbone for clinical analytics. The Institute will lease space until completion of lab and office space in North Bethesda in 2028. Montgomery County will provide 40 million, 15 million in the current year, and 5 million annually for 5 years. And they have secured 3 million in federal community project funding. And Empowering will provide 25 million over 5 years. Moving on to the recommendations on page 17, and this is to see the USM overview for system-wide recommendation. And that concludes my presentation.
Thank you very much. Great job. Okay, we have with us President Bruce Jarrell from UMB. We have Don Rhodes, Dean Roger Ward. I think that's our panel for today.
Thank you. Thank you, Senator King, and thank you to the panel for having us here. Dr. Ward serves as the provost at the University of Maryland, Baltimore, and Dr. Rhodes serves as the chief financial officer. So it's nice to have them here. I want to thank Sarah Baker for her usual thoughtful analysis, and certainly express to the governor and the General Assembly our belief in the many missions that UMB has. In the several minutes that follow, I'd like to give you just a quick view of UMB and a taste of how well we utilize our state funding, and trust that that will be sufficient to convince you to approve our budget. When I look at UMB, what I see is faculty, staff, and students working with their sleeves rolled up, addressing many issues. And it would be logical for you to assume education, research, and clinical care, but also commitment to the community of West Baltimore and the state of Maryland. So we view ourselves as having a statewide mission. We educate many health professionals and lawyers and social workers in this state. Our deans are very focused on maintaining and growing their enrollment, and they also view education hand in hand with community service. So wherever we can put the two together, we put them together. We take great pride that 79% of our professional students are in-state students. Just a brief comment about how we have expanded our programs. We have expanded nursing, as Ms. Baker mentioned, and I will tell you that at Shady Grove, the very largest academic program there is the School of Nursing, with both bachelor's and DNP, nurse practitioner programs. We also recently established every community college in Maryland has an articulation agreement with dual enrollment to UMB School of Nursing. So we're really out there looking for opportunities. In conjunction with Anne Arundel Community College, we moved the physician assistant program to UMB several years ago. That's at 40 students a year, and we plan to increase that to 60 students a year. We also have a leadership academy to teach PAs how to be faculty members. This is available to all the PA programs around the state. So UMES, Frostburg, Towson, CCBC. We're part of the business we're in is creating faculty, new faculty for these professional programs. We also are concerned about the shortage of healthcare providers on the Eastern Shore and other places in Maryland. We recently, just before COVID, got a large HRSA grant to plan for this, and that is now ready to go as soon as we work with funding on that. I would mention to you that the School of Dentistry and its students have a major presence in Frederick, with the hospital to offload the emergency department of the medical center there. So these are student opportunities, but providing help and assistance to the medical center. You will see in our report that the diversity has grown. It's in the written testimony. I just want to emphasize one new PhD support program. We just got a $13 million award from NIH in conjunction with UMBC to recruit and train junior faculty from underrepresented groups in biomedical science. So we think this will help us even further diversify. I hope you will see that we have strong clinical programs. I think we've also maintained very strong research programs. UMB got $654 million in grants last year, grants and contracts. And these are grants that fund many activities, a lot of them basic research, clinical research, but also service and training programs. And I will tell the committee that we keep our research space maximally utilized. There's never enough. And it's research of this magnitude that allows us to do a lot of special things. And let me give you 3 special things. We just got a $46 million DARPA award on working further with artificial blood, something very important. Some of you know we made international news last year in heart transplantation. Ms. Baker just mentioned the collaboration at Montgomery County. That all requires a strong basic research structure to make that happen. And of course, that strong structure also allowed us to address COVID when it came along. We appreciate very much our state support, but I would point out to you that in our overall budget of $1.4 billion, 70%, almost 70% comes from entrepreneurial activities, clinical care, getting research grants, client care, foundations. So we really have a broad source of money for our research enterprises. And just one last thing on research. The National Science Foundation acknowledged that UMB and College Park, our strategic partner in Empower the State, should report our research together. When we saw that number, we were astounded. It was $1.3 billion a year. That's a big number. And to give you the perspective, that puts us in the top 10 of public institutions in the nation. That's rarefied air, and I'm happy to be in it. So our research has never been stronger. Lastly, I want to mention our collaborations, particularly with the community. We take our role as an anchor institute very seriously. We have dozens of programs run out of each of the 7 schools. We're in people's homes with assistance. We're in classrooms. We're in mental health counseling, mental health care, and many clinics across the city. And of course, we have concentrated that in West Baltimore, but we reach around the state. And I've mentioned most of those things. Let me mention 1 or 2 others. The University of Maryland Low Income Taxpayer Clinic is out of our School of Law with UBALT. We work with citizens around the state to help them with their taxes. And we also have a Victims of Crime Center at UMB, which is a one-stop in Baltimore, one shop in Baltimore for wraparound services for victims of crime and other trauma. So a lot of things going on there, and also with the Baltimore City schools. So I've just touched on a few things at UMB. There's many, many other things we could talk about, but I hope that I've given you the picture that we are very engaged. We're engaged within our 4 walls. We're engaged in West Baltimore, and we're engaged throughout this state. Now, Ms. Baker asked me to address one question, to comment on how UMB plans to use the $14.9 million of state funding. This funding is allocated for fringe benefit increases and statewide adjustments based upon the Department of Budget and Management's summary information. These are mandatory costs due to rate hikes in health insurance and other benefits provided to state employees. With that, I will stop and respond to questions, if any.
Thank you. And I enjoyed your presentation today and enjoyed meeting with you the other day, and really impressed with all that UB is doing and all you're doing in the community. It's just a great thing.
Thank you.
Okay. Don Rhodes,
That would be me.
go ahead.
That was our full presentation. We're ready to accept any questions.
Well, now, isn't that nice?
She answers the hard questions.
There you go. Okay. Any questions from the committee? I think we're good then. Thank you very much. Enjoy your afternoon.
Thank you.
Okay, next we have Towson University. Sarah Baker is our analyst and Melanie Perot is the interim president.
Okay, I'm going to start with Exhibit 1 on page 4, which shows trends in first-time applications. The drop in applications in 2015 was due to Towson's decision to stop using the common application. Due to a lot of the applications were from students who had no intention of attending Towson. The 43% increase in 2022 was due to Towson's decision to go back to using the common application. Despite the increase in the number of applications and those accepted, the number who enrolled in 2022 is below the pre-pandemic level. Exhibit 2 on page 5 shows fall enrollment, which declined for a fourth year, decreasing 5.8%, primarily due to a 6.4% decline in continuing students. The largest drop in continuing students of 1,120 occurred last fall, which may indicate that students did not have a positive experience with remote learning the previous year. The number of transfer students has declined 13.3%, and since fall 2018 has fallen by 483, which may reflect the continuing enrollment decline at the community colleges. And this is of concern because this is a pathway of transfer and mobility for these students. We ask the president to comment on the causes for the continuing decline in students and efforts being taken to stabilize enrollment and retain students. Exhibit 3 on page 7 shows the retention rates. In the second year, retention rate declined 83% with a 22 cohort, and the third year retention rate declined 68% with a 21 cohort. Now, these declines may reflect impact of the pandemic and the unique challenges that were faced by each cohort. The 22 cohort, after spending their senior year in high school in virtual learning environment, needed to adjust it to life on campus and in-person classes. And the 21 cohort did not get the typical campus experience where they spent their first year in remote environments. So they also needed help adjusting to campus life. Exhibit 4 on page 8 shows the 6-year graduation rates. Overall, the graduation rates for all students remain steady at 75%, and the rates for underrepresented minorities declined to 70%, and that for African Americans decreased to 69%. Exhibit 5 on page 9 compares the 6-year graduation rate of Pell and non-Pell first-time full-time students and transfer students. And overall, transfer students, whether Pell or non-Pell, graduate at higher rates than first-time full-time students. And the first-time full-time Pell students have the lowest graduation rates. While Towson has been successful with their transfer students, there are opportunities for improvements in targeting programs and initiatives to the first-time full-time students, and in particular, the Pell students. Turning to affordability, in Exhibit 6 on page 10 compares the cost of attendance to the average net price. And as you see, the average net price decreased by $5,000 in 21. However, this is an anomaly and does not provide an accurate reflection of the average cost to students. And according to Towson, this was due to the average weighted housing cost decreased due to more students living at home, and that had a great impact on their average net costs. Exhibit 7 on page 11 shows institutional spending, and spending on aid grew 1.7% in 21 to $31.4 million. The rate of growth of expenditures has slowed from an average of 4.1% in 2016-19 to 1.6%. And this may be due to a number of factors, including the transition to remote learning in 21, the freezing of tuition and fees at the 20 level, resulting in students not needing an increase in award and the declining enrollment. Moving on to the budget on page 8, Exhibit 13 shows budget changes for unrestricted funds by program areas of 22 and 23. Expenditures increased $69.2 million or 15% in 23. And again, as with UMB, most of these increases in 23 are related to the general salary increases. I would note that the 89% increase in operation and maintenance of plant reflects spending on facility renewal returning to pre-pandemic levels. Turning to Exhibit 8, in the proposed budget on page 14. And you'll note that the general funds grow by 12.4% or 22.5 million in 24 after adjusting for deficiencies in general salary increases. In I'm sorry, I gotta get to right to the exhibit. Salary increases account for 63.4% or 14.2 million, an increase in state funds. The remaining 8 million are available to support for other current services or program enhancements. And we also asked the president to comment on how Towson plans to use the available 8 million in state funds. Exhibit 10 on page 16 shows the unrestricted revenues by source, and you can see the impact of the COVID-19 on the compositions and revenues starting in 2020, when auxiliary went from comprising 29% of revenues to 24%, reflecting our closure of campus in the spring of 2020 and providing refunds to students. In 21, auxiliary revenues fell by 44.5 million due to reduced occupancy of residence hall. The federal funds, relief funds, comprise 9% of revenues, thereby tempering the loss of revenues. While auxiliary has rebounded, tuition and fees have not recovered, resulting in these revenues comprising 37% of total revenues in 23, compared to 42% prior to 2022. State funding has increased from 26% of revenues in 2019 to 34% in 23. So moving on to personnel, in exhibit 11 on page 18 shows authorized and filled positions comparing 2019 to 2023. When excluding research and public service, the vacancy rate has increased from 4.8% to 10.7%. During this time period, the number of authorized positions grew 13.3% or 288 full-time equivalent positions, of which 270 are related to instructions. But as you know, in 23, there was 131 vacant positions in instruction. Student services has the highest vacancy rate of 22.3%, and this is of concern because these are basically your frontline workers who deal directly with the students. The recommendation is on page 19, is to see the USM overview for system-wide recommendations, and that concludes my presentation.
Great job. Thank you very much. Any questions from the committee? Senator Benson.
Good afternoon. Perhaps I might want to wait until your report is given, because I have to tell you, I got a little heartburn here when I looked and saw the number of, if you look at exhibit number on page number 5, the number of persons that have transferred out of Towson. That's a little heartburn here. So perhaps in your report, you all can help us with that. And also the problem of the retention of minority students at Towson's, that I'm sure that you will talk with us about that as you give your report. But that does cause a little heartburn here. And then I'll reserve my other questions as we go along.
Okay. Dr. Perot from Towson University, do you want to start?
Great, thank you so much. Senator King and members of the Education, Business and Administration Subcommittee, thank you for having us here and giving us the opportunity to address you this afternoon. So I am Melanie Perot, and I'm the interim president of Towson University, and it is my honor and privilege to provide testimony on behalf of our institution today. With me is my colleague, Ben Lowenthal, who serves as our CFO. I know I speak for the entire TU administration when I say how appreciative we are to Governor Moore, President Ferguson, and the Senate Budget and Taxation Committee for the commitment you have already demonstrated in support of higher education in Maryland. I'd also like to extend my gratitude to Chancellor Jay Perman for his outstanding leadership over our USM institutions. I was honored to have been selected by the Chancellor to lead TU through this transitional period, and I sincerely look forward to working with him and my fellow university leaders to continue the exceptional work already happening at Towson University. And before I begin with our comments, I would like to thank Sarah Baker for her thorough analysis of the Towson University operating budget, as usual. Today, I'm pleased to share that Towson University's momentum is rising to new heights, and with each success for TU comes success for the state of Maryland. As the second largest campus on the University System of Maryland and the largest in Greater Baltimore, TU has truly become an anchor institution for our community and for the state. In fact, through our work to support partnerships in the region, engage with local businesses, and promote entrepreneurship, Towson University was named the top community engaged university in the United States by the University Economic Development Association. TU's impact goes far beyond the campus community. With leading programs in education, health professions, and cybersecurity, Towson University is supplying Maryland's workforce. We are the largest producer of undergraduate health professionals and educators in the state. And our cyber program, one of the first 4 nationally accredited programs in the nation, is helping to fill the more than 100,000 essential cybersecurity job openings here in the Baltimore, Washington region. Towson University is a driver of tremendous economic value for Maryland, to the tune of $2.1 billion during the last fiscal year. And as we pursue R2 classification for high research activity, TU has more than doubled research expenditures in the last fiscal year alone, leading to more opportunities for our students and our faculty as they conduct critical research aimed at addressing global challenges that face our society today. We provide all of this impact as an institution whose students reflect Maryland's population. Towson University educates more Black students and the highest percentage of Latinx students of any USM campus, with minority enrollment that mirrors our state's demographics. TU is also one of a handful of universities nationally where minority, first generation, and Pell eligible students graduate at the same rate as the general student population. At Towson University, all students succeed inclusively. This is why TU is a nationally recognized institution. We're recognized for our diversity, our student success, and our academic excellence. And we create the success with the lowest state funding per full-time student in the USM. With a graduation rate 5% higher than the state average, Towson University is truly a great return on Maryland's investment. And with your continued support, Towson University can continue delivering this remarkable impact for our state. Working together, we can further empower the next generation of Marylanders, propel the state's economy, and strengthen our local communities. And today I was asked to address 2 questions. First, the continuing decline in enrollment and what efforts Towson University is taking to stabilize. So TU's decline in students is due largely to the impact of that pandemic, which caused significant attrition in returning students, as well as a decline in the community college enrollments that led to a significant drop in transfer students, and a small drop in student retention attributed to learning loss during and immediately after the pandemic. TU recently adopted a strategic enrollment plan that focuses on the complete student life cycle, with many strategies delineated between student success and student recruitment. These implemented efforts are already bearing fruit, as TU has had a record number of applications for our first year class for fall 2023, the highest in the institution's history. TU has also started to see success around its student retention efforts in reducing the attrition of students this spring. And last semester, we opened the Academic Commons, a one-stop shop location to support students who require additional academic interventions such as tutoring, academic advising, and writing support. The second question is regarding the $8 million in state funds. And like UMB, those funds are dedicated to mandatory fringe benefit increases. And that concludes my testimony, and we are happy to take any questions.
Thank you very much. Mr. Lowenthal.
Like my colleague, I'm here to answer any questions, but that is our full
That's
presentation.
really nice.
Pleasure.
Questions from the committee? I think we're good. Thank you very much. Thanks for coming over.
Thank you.
Thank you.
Okay, folks. That's it for